PICO, patient, intervention, comparators, and outcome. The question formation usually includes identifying all of the component parts: the population, the intervention, the comparative intervention, and the outcomes that are measured. The acronym for that is PICO, which stands for Population, Intervention, Comparative Intervention, and Outcome. A good way to identify the different parts of your question for PICO formats is to make a table containing 4 rows, one for each letter of the acronym. The table shows what type of information to include in each of these sections. Let's design a few questions using the PICO technique. For example, in patients with acute asthma, how effective are antibiotics as compared to standard care at reducing sputum production and coughing? Let's take another example. In children with a spinal deformity, how effective is bracing as compared to observation at reducing the scoliosis curvature? There are many other examples of PICO. Let's take another example of PICO from the medical field. Review question is: does hand washing among healthcare workers reduce hospital-acquired infections? Let's apply PICO technique and draw components of review question. In this example, P is the hospital-acquired infection. Intervention is hand washing. Comparison is made with no hand washing practices, other solutions or masks. And desired outcome is no or reduced infection. You can master the PICO technique by looking at these exercises and following the PICO table as a specimen. In the next lecture, I will discuss in detail the PIO technique, which is qualitative in nature.